Hi, lab staff. Thank you for joining me in the second in the series of 3 health and safety trainings for the updated protocols for return to school during the pandemic. This presentation has been updated with the most recent protocols and procedures for cleaning and disinfecting that are slightly different from our summer return to school guidelines. So these do reflect the fall guidelines for return to school. This presentation in particular is on hygiene and prevention and the standards for health and safety in our schools. Again, the goal of this presentation is to educate staff on enhanced hand and environmental hygiene protocols in the school setting. Our objectives for today are to identify requirements for school hygiene practices, describe procedures for hand washing, cleaning, and disinfecting, and to learn how to implement the protocols for hand and environmental hygiene. So hand washing, first and foremost, proper hand washing is one of the best ways to protect yourself and others from getting sick. Staff and students should always wash hands in the following situations. New changes to the protocols are highlighted below in bold. So upon arrival to school, before putting on and taking off PPE, after taking off PPE, before and after giving or taking medications, before and after touching eyes, nose, or mouth, after blowing nose, coughing, or sneezing, after cleaning or disinfecting, before and after eating or handling food, before and after feeding a student, including G-tube feeds, before and after using electronic devices or other shared items, after using the restroom, or after toileting or changing a student, after touching high traffic surfaces, which we'll discuss more in upcoming slides, after contact with body fluids, and before dismissal from school. So the procedure for how to wash your hands. You want to start by wetting your hands with clean running water. Apply soap carefully per the directions on the specific product that you're using. Rub your hands palm to palm. Lather the backs of your hands. Scrub between your fingers. Rub the backs of your fingers with opposing palms fingers. Clean your thumbs repeatedly. Clean your fingernails and fingertips. This is especially important because bacteria often gets trapped underneath your fingernails, so you want to make sure that you hyper-focus on that area. Rinse your hands thoroughly. Dry them with a disposable hand towel. Use that towel to turn off the faucet to avoid that cross-contamination from the faucet to your hands. And then your hands are clean. Remember, be sure to wash your hands for at least 20 seconds each time to ensure that you are focusing on all hand surfaces and cleaning your hands for the full duration of time. In the event that soap and water are not readily accessible, an alcohol-based hand sanitizer that contains at least 60% alcohol may be used. However, it is important to note that alcohol-based hand sanitizers are actually regulated by the FDA as over-the-counter drugs, and a physician's order is needed to use hand sanitizer in school. This might be new information to you. It is certainly new information to me. And with this information, we will follow the correct protocols going forward. So what does this mean for us? It means that we've acquired standing orders for the use of hand sanitizer by staff and students through our school physician. Parents may opt out their child of using hand sanitizer in school. In the event that parents choose not to allow their students to use hand sanitizer in school, we will be sharing that information with you ahead of time. Staff supervision of student use is required, and staff are to apply hand sanitizer for young children and any students who need help. This is an exemption per the DPH. Typically, obviously, over-the-counter medications are not able to be delegated to staff members. However, with this exemption that has been granted by the state, we are able to allow staff members to supervise and apply the topical hand sanitizer to our students in the event that parents do not opt out. So how do you use hand sanitizer? You want to apply the product on the palm of your hand, read the label to learn the correct amount of hand sanitizer that you should be using. Rub both of your hands together and rub the product over all surfaces of your hands and fingers as you would if you were using hand soap and washing your hands. And you want to do this until your hands are completely dry, which is an approximate 20-second duration. So moving on to environmental hygiene, cleaning versus disinfecting. What is the difference? Cleaning physically removes germs, dirt, other impurities from surfaces or objects. This process doesn't necessarily kill any germs, but it does lower their numbers and the risk of spreading infection. So if you're using soap and water or a detergent to physically remove those germs from a surface, an all-purpose cleaner, that sort of thing. Disinfecting does kill germs on surfaces or objects, and this process doesn't necessarily clean a dirty surface or remove the germs, but by killing the germs after cleaning, it further lowers the risk of spreading infection. So if you're using our Sani wipes, a lot of people like to call them our purple wipes, or if you're using our Avastat D, our 105 sanitizer, this is going to kill bacteria and viruses on any given surface. For cleaning and disinfecting, what are our high traffic objects that we are concerned about? It's a large number. We're looking at any items that you or your students are going to touch with increased frequency during the school day. So desks, tables, chairs, countertops, doorknobs, light switches, handles of drawers or cabinets, mats, whether that's in the PT room or your personal classroom, any sort of appliances, laptops, keyboards, tablets, iPads, trackpads or mouses, phones, walkie-talkies, fax machines, copy machines, smartboards, any of your adaptive equipment, that's PT, OT, speech, utensils, toys, sensory objects, toilets, faucets, sinks, changing tables, commodes, and adaptive toileting seats, and any shared items. Ideally, there should be no shared items, but in the event that you have to share technology or whatever items in your classroom may have to pass between staff members and students, should be cleaned and disinfected between uses. So when should you clean and disinfect officially? The frequency of cleaning and disinfecting an object, surface, or area is dependent on the frequency of use and the exposure risk of that item or space. So staff are going to receive a daily checklist to post in your classroom or your office and check off the cleaning and disinfecting activities as they occur in accordance with the appropriate frequency, which we'll talk about in an upcoming slide. So when should you clean and disinfect these surfaces? Again, dependent on the object, surface, area, and the the need or the soiling of that item. So an object or surface that is visibly soiled should be clean and disinfected immediately. Doorknobs, handles, light switches, handrails, things that are touched periodically throughout the school day should be clean and disinfected daily at the end of the school day. Bathrooms, toilets, faucets, change-in tables that are used with a relative frequency throughout the school day should be cleaned and disinfected after each use. Desks, tables, chairs, countertops, things where there's relative assigned seating. You're not going to have a lot of overlap in terms of who's going to access that space. That can be cleaned and disinfected twice daily, in the morning and afternoon. So your electronic devices, laptops, keyboards, tablets, smart boards, remotes, touch screens, trackpads and mouses, fax machines, copy machines, and any other electronic devices. We're assuming, hopefully, that there won't be any shared items, but in the event that there are, these do need to be cleaned daily and cleaned and disinfected between contact with others. Other items like mats, adaptive equipment, exercise equipment, therapy equipment, or, sorry, my apologies. My Zoom decided to block off that bottom piece there. So utensils, toys, sensory objects, and phones do need to be cleaned after each use and obviously between contact with others. So cleaning and disinfecting, how are we going about this? So you're going to want to clean using a soap and water or all-purpose cleaner. In the image that's provided here are the two that we are very likely going to be using for this school year. We have the 101 neutral surface cleaner or the method all-purpose cleaner. Both are interchangeable. Whichever one you have is the cleaner that you're going to want to use. Obviously, if you have like a Dawn dish soap that you can mix with the water and use with on a surface, that's an acceptable alternative. Disinfecting using an EPA registered disinfectant. For us, that's going to be the Avastat D or the 105 sanitizer sprays. The purple wipes, those Sani wipes, are an interchangeable alternative. Unfortunately, they are very difficult to come by right now, so the sprays are more readily available and more accessible to us right now. So that's what we're going to use at our program sites. You are going to want to follow the label directions on our cleaning products and disinfectants, and of course, each classroom will be provided with the necessary products for cleaning and disinfecting their environments. An update from the previous presentation is the disinfectant use protocol. When using disinfectant sprays, such as Avastat D or the 105 sanitizer products, staff are required to wear gloves, surgical masks, and face shields. There are a number of hazard risks that are associated with using these sprays, simply because the aerosolized spray can be a respiratory irritant. It can be very irritating to your skin, and it can be very dangerous in the event that it does enter one of your mucous membranes, again, your eyes, nose, and mouth. So we do want to make sure that everyone who's using these products is wearing the appropriate personal protective equipment. In the event that you do have access to the purple wipes, if you've kept a secret stash, as I would hope that you did, I hope that you have access to those products, because obviously the wipes are in high demand. The Clorox, Lysol, Super Sani wipes are something that are very difficult to come by right now, but something that are preferred because you don't have to use a spray and a paper towel. If you have those, then you should be wearing gloves. No need to wear the face shield in addition to that, because you don't have the hazard risk of that backsplash from the spray. So again, cleaning and disinfecting, we want to avoid cross-contamination. So you don't want to use the same area of cloth across multiple objects or surfaces. In the event that you're using a microfiber cloth, you want to fold the cloth in half and a half again, as per the diagram that is indicated here on this slide. Each quartered section may be used on an individual surface, so there are 8 sections total on any given cloth that can be used across 8 separate surfaces. If you are using a paper towel, you don't want to use that same paper towel across multiple objects or surfaces because you would be cross-contaminating. You want to dispose each individual paper towel after each use on a specific object or surface. So what are the steps for cleaning and disinfecting a surface? There are 6 steps. Step 1, you want to put on gloves and eye protection if needed. Again, for those disinfecting sprays, you are going to need that eye protection. You're going to want to use the face shield. Step 2, wipe away any visible dirt, spills, debris on the surface. Step 3, use soap and water or that all-purpose cleaning product to clean the surface. Again, removing the bacteria and viruses from that surface, but not necessarily killing anything that's on that particular object. Step 4, you use the disinfecting solution or wipe, if you have access to the sanding wipes, on a surface and allow it to dry completely. If you are using the 105 or the Avastat D disinfecting solutions, you can spray that on a surface without wiping away, because either way it's going to kill bacteria and viruses on that surface. You just want to make sure that you allow it to dry completely before you or any of your students touch that surface. Step 5, remove gloves and wash your hands as you would after using any cleaning and disinfecting solution. And then step 6, provided that the surface is dry, it's now ready for use. Additional considerations for cleaning and disinfecting. You want to store cleaning products and disinfectants in a secure, temperature-regulated area and keep out of reach of children. This should not be left out in any public space or in your classroom. Pay close attention to hazard warnings and directions on product labels and wear appropriate PPE for use. Again, with cleaning products, you typically don't need to wear anything more than gloves, but using the disinfectants, because of the increased risks and hazard associated with chemical products, you do want to also wear a surgical mask and that face shield to offer full eye and face protection. Open windows and doors when using cleaning and disinfecting products to ensure adequate ventilation. This will be especially helpful for those that do have underlying medical conditions such as asthma or seasonal allergies, as the upcoming bullet is the caution that these products can trigger asthma in applicable individuals. Students and staff with asthma should stay away when products are being used and until the surfaces are completely dry. It can be a respiratory trigger. It can cause some triggering asthma and allergy symptoms in those that do have those underlying conditions. So you are going to want to adequately ventilate that space when you're cleaning and disinfecting the area, and people with those diagnoses should, to the best of their ability, try to stay away from those specific surfaces. Try to physically distance. So cleaning and disinfecting, just a couple additional considerations. What if there was a sick student or staff member in that room? You're going to want to close off the area used by the sick individual. Open windows to increase air circulation in that area. Wait as long as practical before cleaning and disinfecting. After the wait period, clean and disinfect all areas used by that individual. And at the end of the day, custodial staff will clean and disinfect the room per their own protocols. In the event that someone with a confirmed COVID-19 case was in the room, if we received that notification, it's the exact same process, but if possible, staff should wait up to 24 hours before cleaning and disinfecting the room. So this concludes the end of our personal and environmental hygiene presentation for school staff. Our next steps are the competency assessment, which is the post-test. It is a very short post-test. And the consultation with nursing department. So what are your product needs for your classroom or discipline? This can be included in your supply request form. The cleaning, disinfecting, paper towels, supplies is part of that overall request. But if you have any additional concerns, please feel free to reach out to me directly. Any questions about the cleaning and disinfecting process, hand sanitizer, hand hygiene in general, any questions about the content that we've covered today, please feel free to email or call me directly. So thank you guys once again for joining me for this presentation, and I will see you for the final training in this series on personal protective equipment. Thanks, guys.